So one quick message just to kind of take advantage of the fact that we have as many of you here as we can. Christy asked me to pass along a message on rural emergency hospital information because we know there are a lot of questions that are coming in. As they are a new provider type right now, there is no legislative program to support them. The REH TA Center that we have, the National TA Center, will be providing TA at the national level for REH's post-conversion in the future. However, we don't really know what that looks like yet because this is new. We're learning at the same time as all of you are. So as we have more details, we will let you know what those are. But as it makes sense, if you as a state have rural emergency hospitals that could be looped into your relevant flex activities that align with the current critical access hospital priorities that you have, you can include them. That's okay because they are, we know the flex programs are really bringing everybody to the party. So you can always talk with your project officer, talk with me, talk with Christy, and we can kind of work through some of those priorities as they come up. We're all learning, like I said, just like you all are. So in the upcoming PO office hours, there are going to be some questions that we may ask you all about what questions you may have about rural emergency hospital TA needs. So that's another time to connect with us and your project officer. Christy may jump onto some of those calls to ask some of those as well. So just shoot me an email if anybody has any questions on that. And that was the last message I had from Christy. So really what we're about to do right now is go through all of the nitty-gritty details on your non-competing continuation NCC progress report. I know this can be a little bit overwhelming because we do have a lot of new flex coordinators that are filling these out for the first time and completing these documents. So all of the instructions are here in these slides. They're on the TASC website. We have lots of resources that we'll go over. You're going to hear from me. You'll hear from TASC. You'll hear from the flex monitoring team folks. We'll have an MB Quip update for you. So stay tuned. But like Matt said, feel free to put questions in the chat, come off mute and interrupt me, and we can answer them in any way we can. And then we'll be able to keep answering questions along the way afterwards if you have them. Next slide, please. Like I said, the first thing we're going to do is go over the progress report instructions. So this will be details on each attachment and what to include in there. And then we're going to have John Gale from the Flex Monitoring team do a little bit on outcome measurement. I actually think this agenda might be out of order. I think TASC might be first. Sorry about that, everybody. I think TASC is coming first to talk about their technical assistance resources, and then FMT talking about some outcome measurements and some great resources they've put together for you. Then we'll have Natalia at the end with an MB Quip update and time for questions. So just a quick background, this progress report that you submit to us is the basis for basically you're asking for your funding for the FY23 program year, right? So it's a streamlined review process. This is telling us, it is a true progress report. It's telling us how all of your activities are going so far in this program year. That's saying I'm meeting my goals, I'm making progress, so I need funding for next year in order to continue to do so. I know in FY22, this past year, we did have a funding increase. So I can tell you to please plan all of your work plan activities and your budgets based off of the FY22 funding level. Now, that is without the rural emergency hospital supplement, but it is with the increase in appropriations. If you have any questions on what that amount is, you can either email your project officer, you can email me, or there is an appendix on the instructions and it's all posted on the TASC website. There's a whole big table with all of the funding numbers, so you can find it there. So again, FY23 is the September 1st of 2023 to August 31st, 2024 program year. It is year 5 of your 5-year project period. This submission is due in EHB on May 5th. Now, I know in a lot of cases, there may be times when we can give certain extensions if there's a concern or a reason. If you think you may need an extension on this, please, please, please reach out to your project officers as early as possible because we have internal deadlines that we need to meet. So please just communicate with us and let us know kind of what's going on and what we can do. So really the purpose of this is to just, like I said, discuss any progress in your activities, any changes you've made to your work plan, any challenges you've been facing this current year, and what you think you're planning on doing next year in the future of the program. And again, this is going to be your project plans for the continuation of your funds. This is a little bit of an opportunity where we can kind of make some small readjustments, some updates, refine your projects if you want to for next year. I will say this is not the opportunity. This is not the place. If you want to start making huge changes to your work plan that involve a change in scope, that may be a different conversation to have with your project officer, but that's not the process where you would do that with your NCC. So we can talk about that separately if we need to. Next slide. The first thing that you're going to submit is what we call our performance narrative. So this is no more than 10 pages in a really easily readable font. And please put all of your documents in either a PDF, a Word document, or a Word doc, or sorry, a docx. Your work plans can be in Excel. It's really difficult for us if any of your attachments are uploaded in an image file, because sometimes we need to copy and paste into our own notes, and it's really hard to do that with images. But the point of this performance narrative is really to tell us the story of your work plan. So we don't want to see the copy paste of just both of those documents, right? We really want to know, how is everything going? Are you struggling in certain areas where activities are hard to get off the ground? Are you succeeding in other areas where you think this is a really shining star moment and you want to let us know about it? It's really telling us the story. And as a reminder, this is intended to report on the flex program activities only. I know a lot of times there's some things that SHIP might be doing or SOAR might be doing. This should be only for your flex program activities. Next slide. So this will be progress on your activities. So again, just for this current year, the FY22 budget year, I know we're only partway through it, but this is where we ask for a summary on how everything is going. We don't expect you to have outcomes ready yet. We don't even expect you to have final outputs ready yet. This is just where you would tell us everything is proceeding according to plan. We've had more interest, less interest. You know, this can't kick off because our EMS decided there's a different priority, whatever it is, right? This is where you would tell us that. And additionally, this is where we want you to include any information if you have incorporated any health equity activities into your program. This is where we want you to put that information so that we can see it. It's a huge priority for our administration. And so anytime we hear about health equity, we want to make sure that we're sharing that you all the wonderful work that you all are doing. Next slide. Great. Also, if there are significant changes to your project, where you had to previously submit a prior approval request, a change in scope, if there were key personnel changes, you brought on a new flex coordinator, for example, you can describe those here. Again, this is not where you would be asking for that prior approval. This is where you would tell us that this happened this year, right? And then we need a section talking about what your plan is for this upcoming year, for year 5. Just so that we know, and again, this is going to be a summary of what you're proposing in your work plan. We don't want you to copy paste those things. Those are 2 different documents. They're made for 2 different purposes, but tell us a summary and tell us the story of what you're trying to tell next year. Next slide. Now, as a reminder, all of your activities need to fit within one of these core program areas. You've seen these in all of the work plan documents. None of this has changed. Those are all going to stay the same. Oh. There we go. So as a reminder, those are all quality improvement, financial and operational improvement, population health, rural EMS, innovative model development, and the critical access hospital designation. If you have needed to remove one of those program areas or add in a program area, that is what is considered a significant change and would need a prior approval change of scope in EHB. So please reach out to your project officer if that is what you are thinking of doing. Next slide. Next up, we're going to talk about all the attachments that we need. This is the list of the attachments. You will see that 3 of them at the end are only for those states that are doing EMS supplement work. So we'll get to that in a minute. I do want to stress one thing. The work plan documents are listed as separate right now, right? The current work plan for FY22, this is where we need an update on how everything is going. The future work plan for FY23 is what you are proposing to do next year. You can combine those into one document and one attachment, as long as they're labeled separately, so we know the difference between them. Next slide. So here's just some helpful tips. Please feel free to go back and reference these when you're working on your attachments. All of your attachments should include your grant number, your project title, your organization name, and the primary contact name for your organization. That's because these also, like me as your project officer or Talia as your project officer, we all know this information and we all know who you are, but these also get sent over to our GMSs and they may not be as familiar with who the primary contact is. So we want all that information on those documents. Please attach only the documents that are listed in those instructions. If there are missing pieces of the information or something doesn't make sense, oh, thank you, Tracy. Yes, GMS, Grants Management Specialist. I do speak in acronyms now. If there's anything missing or something doesn't make sense, or there's an attachment that got forgotten, we can send it back to you to request changes, and then you can make those changes and send it over to us again. We do have a favor to ask, if you can, when you label your file attachments, if you can please start all of them with your state postal abbreviation, and then tell us what the attachment is, right? You can see some examples here. My Flex narrative from Alaska Flex narrative FY21, or Massachusetts Flex budget justification. This tells us when we get all of those files downloaded, we put them all into one central place. And if I have 45 states that have all labeled everything, attachment 3, budget justification, I don't know who belongs to what, right? So if you can please put your state name in there, that would be really helpful. And again, as I mentioned, please don't scan them as images. We may need to highlight or make copies of the copy and paste the text and things like that. Next slide. So I'm going to go through some details really quickly on what to include in all of these attachments I just mentioned. So all of these links are current and up to date, and everything links back to the TASC website. And I know they're going to talk about all of their resources in just a minute. So the work plan template is right there listed for you. As I mentioned, we need an update in your current year's activities. So this should be any new activities you've added, any change of scopes that you may have gone through. If you've stopped an activity, it needs to be noted and identified in there. This activity has been stopped for this reason. This activity was started, and here is my progress, right? Even if the progress so far on your activity is, we're still having conversations, we're trying to get this off the ground, I don't have an update yet, that is still an update, right? We need to know all of those things. If you just put in there no progress, then to us, that looks like nothing's happening, when we know there may be something happening. It may just be that there isn't an output yet. So please give us all of that information. We want to know so that we have a current picture of what's going on with your program. And this will be the same thing for FY23. We want to know what you're planning on doing next year, right? So are you adding in any new activities that may be different from this year? Are you removing any activities from this year that you don't want to do next year? Please make those notes in that work plan, even if all it is just a little parentheses next to the name of it that says new, or, finished, or, removed, whatever. That helps us know how everything is going in your work plan. Now, for many of you, if you remember this webinar that we had last year when we were planning on NCCs, we had asked everyone to choose oh, Jill, I see your question. The EMS supplemental instructions are in the same instructions for this regular Flex submission. They're all in the same document. So we can get to that momentarily. So for the outcomes, we had asked everybody last year to select 2 outcome measures for this current year's program. What we are asking you to do next year for FY23 is to select 3 to 4. That is not 3 to 4 additional on top of the 2. That is 3 to 4 total. Okay. This is really, really just a chance for us to get everything ready as we get ready for the NOFO and the competitive cycle. We're going to be looking a lot more at long-term impact and focusing on outcomes when that comes in the NOFO and the competitive year. So this is just a way to kind of get all of your contractors ready, make sure everybody knows what's happening, and get the process settled. So we do have 2 great links in here. These again are going to go back to the TASC website. The first one everybody may remember from last year, where these are example outcome measures on quality improvement and financial and operational improvement. We have a brand new, ready as of this morning, hot off the press from FMT, example outcome measures in population health and EMS. So John's going to talk about those in just a little bit, but that link is right here, so you can go see those, and they'll just have examples. I'm not saying that you must choose one of those. I'm just saying those examples are there if you would like to choose one. Next slide. This is the work plan template. It's the same as last year. And you will notice on the very right-hand side there, when you're looking at this interim outcomes column, if everybody could do us a favor, and whatever you are planning on measuring on these outcomes, if you can list it there, that would be very helpful for us. I know the 5-year tab is also available, and you can put it there as well, but it's easier on us as project officers. This is how we've been able to do this. If I can make the exact distinction of this activity connects to this outcome, right? And so some of those examples might be a decrease in falls rate, a decrease in the number of claims denied. That's the kind of information that we're looking to see here in these interim outcomes. If you have any questions on what kinds of outcomes may be able to come from your activities, reach out to TASC. That's what they're here for, and they can help you kind of brainstorm some of those ideas. Next slide. Now here is this is just an example, but this is one of the most common questions that we received last year when we started talking about outcomes. So I want to be clear on my expectations with this. When I say outcomes, I'm not asking you to start new projects right now and new activities, right? What we are asking is for you to take an example of, look at the activities and the projects that you are already doing, right? And just kind of take one further step in the data collection. So one of the things that everyone is doing right now is looking in financial TA. Everybody is doing this, right? So effectively, this is just two examples. These two are the same thing. Now, an output is the number of hospitals that are completing interventions, right? And that is a really great output. What we are asking is, if you have that same activity, take it one step further. And what we're saying is collect an outcome, right? We want to decrease the number of days and net counts receivable, right? So this is all we're asking. We're not saying go out and start a bunch of new projects, because we know that you can't get to an outcome sometimes in only 1 year. We want you to look at what you are already doing and just take one maybe data collection step further in that. Before I go too much further, I do see a question. Can you explain why they are called interim? Because in these work plan documents, when we started these last year, we're really only working with like 2 years, right, of collecting these outcomes. And I wouldn't qualify a 2-year outcome as a long-term outcome. That might be more on the 3, 4, or 5 year slide. If somebody from TASC wants to dive in and tell me if that might be a different answer, that would be what I would say. But TASC, I don't know if you may have a different answer on that question.
This is Tracy Morton. I can add to that. And I think that, and John Gale is probably the best expert on this, but I think that, long-term outcomes in this world that we're talking about here are things that are within the whole project period, 5 years or more. You designed a set of activities to meet a particular goal or objective, and that you're hoping to make a really influential change within 5 years. Interim is just taking it back a shorter timeline than that. So things that we would expect to see happen within around 2 years or so, I think is actually more accurate, Laura. And when the original set of this work plan was designed in the template that you all are using, I don't think that we as the collective, we here within FORHP and FMT and TASC and such, really articulated that well when we were asking states to design the 5-year outcomes tab. And there was such an emphasis then within the programs about the outputs, because those were things that were more tangible to the states in the earlier years of the current cycle that we're in, about what we're doing over these various years that add up to that 5-year outcome. So interim is in between there. John Gale, I'm not sure if you have something more specific to add about a particular time frame to reference with interim.
No, Tracy, I'd agree with everything you've said. The long-term goals are the higher level. I don't want to call them solely aspirational, but it's really where you want to see the performance improvements lie, and that would be towards the end of the funding cycle. And then the interim are anywhere between 1 year to 2 years. And these are the steps that I think Laura had mentioned, that it's hard to measure long-term goals. Part of that is because it takes a while to get to those long-term outcomes. And part of it is because the hospital, the environment these hospitals operate in is so complicated that while you may want to improve the profitability of your hospital, there are things outside of the hospital's control. State policies around Medicaid, whether or not their states have even implemented the Medicaid expansion or not, that it's hard to tease out the direct influence. So you want to count the interim steps that lead you to believe that you're improving, say, hospital margins. Part of that's reducing costs, or it could be improving cash flow, or any number of things. It's sort of a pathway, a set of interim steps that are going to lead you to long-term goals. And these are the things you're most likely to be able to measure within the course of your funding cycle.
Thanks, John and Tracy. Any other questions on the work plan before we go into our budget narrative? Okay, let's move on. All right, so your next attachment is going to be your budget narrative. This is where you can discuss any of your changes to your budget less than 25% of your total award. As a reminder, if you have a change that's more than 25% of your award, that needs to go through a prior approval process with your project officer in EHB. So we need detailed costs within each budget category. And again, please base all of these funding levels on that FY22, this current year's funding level with the 9% increase. So I'm going to go through the categories here and just give you some of the caveats, and then I'll show you something in a couple of slides. So under personnel, what we need here, you can see all of this is written out. So we need whoever is working on this grant, we need their name, their base salary, the percentage of FTE that they are in the grant, and the amount of federal funds that are expended for the budget year. This information also applies to subawards and subcontracts that are supported by your federal funds. And as a reminder, every flex program needs at least one FTE dedicated to the flex program. Now, that could be split up across multiple people, but as a cumulative total, there must be at least one FTE. Next slide. Travel, we need to make sure that those are broken down and itemized by the staff member, and then also including airfare, hotel, per diem, mileage, car rental, ground transportation, parking. And please make sure that there are a couple of things, a couple of travel things that are required to make sure that we have you all include. So the annual Flex River site visit for next year will be required. We are planning on having that in person, pending no changes from the CDC, as well as one other regional or national meeting. And for any Flex programs who have a new staff member that is directly responsible for executing the duties of the Flex Award, then we need you to plan to travel to the Flex Program workshop in Duluth within 1 year of their start date. So both the fall workshop that's coming up and the next spring workshop in 2024 will be part of this program year. So you would need to plan that in those travel costs as well. Equipment costs and provide justification for them, supplies. As everybody knows, equipment on this grant is not allowed, and that is anything over $5,000 per unit, but supplies are allowed. So that's anything under $5,000 per unit. Next slide. Under contracts, this is one of the most common questions that we get when it comes to contracts, and this is included in the instructions, and I'll explain it here a little bit. So we need a clear explanation as to the purpose of the contract, how your costs were estimated, and the contract deliverables. One of the most common questions we get is, I need a contract to do, for example, financial improvement TA. It will be for about $100,000, but I have to put that out for RFP. I don't know how that's going to break down yet. We understand that that happens. However, I cannot send over to a GMS, and a GMS cannot approve if a budget just says $100,000 financial contract. They can't approve that. So what they've said is, I just checked this with our lead GMS to give you this instruction right now. You need to list in what you expect from this contract. So it's okay if certain things may change. So things like your contract deliverables, if something changes from 2 webinars to 3 or whatever it may be, that's completely fine. But we need to know what your expectations are. So other puts anything in there that does not fit into those categories. And then of course, your indirect cost rates are anything that they cannot total any more than 15% of the direct cost of the total award. Or sorry, 15% of the direct cost, which comes to approximately 13% of the total program award. I do see a couple of questions that have come into the chat box, so we'll just say those out loud in case anybody else has seen them and not read them yet. So just to confirm, for both the work plan as well as the budget narrative, anything that gets approved from the carryover request just recently should be included. Actually, I want to make a quick amendment to this. For the updates in your work plan, as far as the activities that you are doing and things like that, yes, that should be included in there. But if you're talking about your budget narrative, your budget is for your next program year, starting in September 1st. And all of your carryover funds should be expended by the end of this program year, by August 31st. So those should not be included. Your budget is only going to be preparing your next program year. Follow-up question, is the Flex Program Workshop travel reimbursed by TASC, or will this expense be incurred under the Flex Grant? The answer correct, it will be incurred under the Flex Grant. It is not reimbursed by TASC. If the current flex coordinator position is open at this time, maybe show staff person as TBD, or do I need to list the staff persons in the interim? Actually, I am getting to that attachment next. You can show them as TBD. And we can kind of work with you individually too on that, but that budget or that attachment is coming up next. Column F for the future work plan. Is this where we note the 3 to 4 selected measures? Do we include measures on every work plan line? No, you do not need to include measures on every work plan line. The 3 to 4 selected measures is where that can go. Yeah, in column F. We understand that not everything has an outcome attached to it. That's why we're saying for one, only 3 to 4 measures right now, but not everything is even going to have an outcome even in the future. So yes, go ahead and put those there. Okay, can you go back to the salary piece for contractors? Yes, Matt, can you go back a slide or two, please? Oh, wait, sorry, one more. There you go. Okay, personnel, one more, back. Perfect, okay, yes. So if you are paying salary costs to your contractors, we also need to know kind of how that breaks down, right? So some people, and they all kind of get listed under the contracts line. It should probably not be listed here under personnel, but it all kind of depends on how each contract breaks down, right? There are some people who pay their contracts based on deliverables. So it's based on like the number of reports written or TA calls received or webinars given or things like that. There are other contracts that break down where you pay it by contractor staffing hours, right? So we need to then know who is that contract staff person, how much FTE do they dedicate to that, et cetera, et cetera. There are also other states, and this is all dependent on how you set this up, that use contractors to meet their personnel requirement. So that piece all falls under this as well, where we do still need to know what is their base salary, what is their percent FTE, what is the amount of federal funds expended for their budget year. One final note on the budget, these are just the budget restrictions. So flex funding cannot be used for anything as far as direct patient care. So no equipment, no healthcare services. We're not paying doctors' salaries. We're not buying vaccines, anything like that. Cannot purchase ambulances, cannot purchase vehicles or other major communications equipment, cannot purchase or improve real property, or any purpose which is inconsistent within the language of the NOFA, which is linked there. Next slide. Now, this is a fun resource that I have linked here, and I'm sure TASC is going to talk about this later. There is a budget justification template that you all can use. You are by no means required to use this. If you would not like to, you can use whatever format you would like, but this actually has a great example of the way that the content needs to be broken down. And so what I always encourage everybody, it's the same as the work plan. You don't have to use that template either, but look at the content in this template, and this will help you write your budget narrative, or use the template if you so choose. And if you have any questions, as always, you can reach out to TASC and you can reach out to your project officer as well. Next slide. Okay. Here is where we're going to be talking about any staffing changes. So there's 2 attachments. Liz, that template is linked on the TASC website. It's the main funding guidance page. I think TASC will probably talk about this in a second when they come, and all of the links are in there, or you can click the links within this slideshow, but we can get that to you for sure. Perfect, Nicole. So the next 2 attachments, your position descriptions and your biographical sketches. So any person that is new to your team or will be new to your team, or any changes in positions that you've made to your flex program staffing, you would need to put here in attachment 4 in your position descriptions. If you have none, if everything has stayed the same, you have no new people, nothing has changed, we still need you to attach this document. It is still required, but you can just state no changes on it. But anything else, this is where you describe what the position is. And if it is a new project director that needs to be done, that needs a prior approval through EHB. So please reach out to your project officer. Next slide. Attachment 5 are the resumes for all of the new staff. So whoever you hired and listed in attachment 4, you need to put their resume here in attachment 5. And this is for people who have been hired since the submission of your previous NCC. So that means May of 2022. So just in this last year. Again, if you have no changes and there are no resumes to submit, please still submit this document, but say no changes on it. Next slide. Okay, so here's our instructions for your EMS supplement progress report, and I'm just going to blow through it. So this is only for the current FY22 EMS supplement awardees. This is not for the supplemental, the EMS supplement grantees that are finishing up from last year. Okay. So you need to provide a progress report for progress made. Oh, I see here. Attachment 4 and 5. If we have staff covering an open flex position, do we still need to list them as new staff? Yes, I would, just so that we know they're new. Okay. So this progress report for your EMS supplement, this is for progress made so far during this current year. So starting from September 1st of 2022 up until you write this report and submit it, and giving an idea on the future activities for FY23. So you should include your significant progress, your changes, your challenges faced, that you faced so far, or what you are anticipating in the remaining of the year, including any activities that may not be finished or may be delayed, or that might need a change in scope. Again, here is where you can discuss any staffing changes that you've had since the start of the year, any plans that you have to mitigate or manage any significant changes, challenges, and barriers. This should be about 2 paragraphs. Next slide. We also need you to have a EMS supplement budget justification. So this is for your budget plan for the coming year, for FY23. So this is the same categories, it's sufficiently detailed as the previous flex budget, your regular flex budget, just for your EMS supplement amount. And again, your travel and contractual costs must be itemized. So including your airfare, your mileage, your lodging, your per diem, any other requirements that you have for your travel policies, and your itemized contractual costs should include your deliverables. Next slide. For the EMS supplement work plan, we need you to do the same thing that you would for your regular flex and update us on your current year activities, as well as propose your future year FY23 activities. This supplement is the work plan template is linked right here, so you can use it, or you can just update the current one that you've already submitted. Next slide. Okay, reminder and reporting requirements. So to finish up this program year that we're in, FY22, on October 30th of this year, you'll fill out your PIMS report, Performance Improvement Management or Measurement System. November 30th, you'll submit your end of year report. FFRs are due on January 30th. Your carryover requests are due on March 1st. And the next year's NCC is due in May of 2024. We will have further webinars and further emails and further instructions on how to complete all of these, but this is just to put the dates in your calendar so that they are there for you. Next slide. Okay, before I switch over to TASC, are there any questions on those directions? I know that was a lot of information and it's a lot of technical stuff. We are here to help.
Yeah, Laura, can you hear me?
Yes, I can.
Yeah, it's Catherine. Just quickly on your last slide, I know it's far in the future, but the NCC for when it's due in 2024, isn't that one usually backed up to like March when it's the start
It would
of
be
the next 5 year?
Oh, that's a very good question.
Usually, I think we get the guidance in January and it's due in March. If it's
But I actually think this might be a typo on my part, because if we're doing a competition, there won't be an NCC.
yeah.
So yeah, that was my bad. Everybody please ignore that. Ignore that last line. But
I'm here.
all those
I'm
other
here for you.
This is why I love you, Catherine. Thank you.
Okay, good to know. Good to know.
No, thank you.
Thanks.
All those other dates are correct. There will still also be a carryover request that you could do. But yes, I am so sorry. That was my bad. There will not be an NCC next year. I copied this table over from last year's presentation, thinking that I didn't need to change that.
So yes, we want to, as Laura had mentioned multiple times, we want you to reach out to TASC with your questions if you need something. It doesn't matter if you think it's trivial or important or anything like that. We're here for everybody. We're here for all questions. And you guys heard me joke around it. We'll help you choose what you want to have for dinner tonight, if that's where you want to go with it. So feel free to reach out to us. We are available to review one component of your cooperative agreement application prior to your final submission. Like we may look at your work plan or your budget narrative, etc. So if you were like, hey, I really want TASC to review this one thing, we can do that. Obviously, we have limitations to reviewing every part of every component of the cooperative agreement application. That's a lot. And so if you would like assistance, you can submit your request to task@ruralcenter.org. by the 20th of April, so a month and 6 days, and give us about 5 business days to review. Now, here's the thing too, is you don't have to wait till you're 100% done with it and ready to submit for us to review either. If you've got a couple of good rough drafts and you just want to set eyes on a specific section, send it to us. We're happy to review that. Now, we won't go through and edit every comma splice or every misspelling. We're just going to more review it for content. Okay. And unless there's something horribly out of place that affects the whole document, we won't be editing for grammar and whatnot. And so we do want everyone to participate in the new Flex Forum, or the Flex Forum, which is now in a new format. Your questions, your comments, your tricks, your tips, especially for those of you that are experienced, things that you've gone through, how much coffee you need to have during this time. That's good news. We want you to share that information so others are prepared. But the sharing aspect is something we hear a lot about. You guys love hearing from other people, how they've worked through these things or how they're planning. This is a perfect opportunity for us to engage in sharing and conversation. And of course, if you have not created an account yet on the new forum and would like to, you can email us at flex-forum@ruralcenter.org or task@ruralcenter.org. We'll make sure it all gets to the right place. So please use that to share your knowledge and absorb knowledge as well. We do have some resources to support your Flex program cooperative agreement application. I do believe links have already been put in the chat. And there's more. You can go to the funding guide page on our website, guidance and supporting materials. We have the NCC progress report program, specific instructions, the work plan template, the budget justifications, and the TA webinar playback. That will be this. In a couple of days, we'll have this on there. We also have, Laura had mentioned that we have some examples of outcomes, and those are already on that page as well. So we have all that ready to go, including these slides that you're viewing right now, if you want to take a look at it to get started. But if there's something on there that you do or something that you need that you don't see on there, feel free to email us, chat us, do something of that nature to let us know how we can help you. And then with that, unless somebody from TASC has additional, John, I'm going to pass it to you. Are there any questions that I can answer? I can't see the chat box because I'm sharing my screen.
The only question that came in, it's already been answered, but it might be one to share for everybody else, was if the one component that you could review would be the outcome measures that people chose. And that answer is yes, I believe.
I do believe that is one of the areas we can review as well.
Yeah, excuse me, this is Caleb. And absolutely, we can, as Laura said, we can help have a conversation to develop what an outcome or an appropriate outcome measure might be. We'd be happy to, loop in or send an email to the monitoring team to clarify some things. Anything that was big enough for the rest of the group to benefit from, we can always send an email out to the entire team, the Flex team, or post things like that in the Flex forum. But yes, we'd be happy to have conversations or review both work plan, outcome measures, narrative, any of those sections.
Perfect. Thank you, Caleb. All right. If there's no further questions, John, I have the slides up here. I think you're looking at them too. So I will pass it over to you.
Great. Thanks, Matt. So what we're going to do today is just give you a brief set of examples. Do you have my slides up, Matt? There we are. Thanks. It's really just go over some sort of basics of outcome management to help you with this next NCC. So as in the past, we've worked closely with the office, and based on a lot of the work we've done with many of you on this call to come up with examples of outcome measurement. And this is a process that I think has evolved over time, and we're really trying to support FORHP's focus on measuring valuable and useful outcomes. So this year, in the past, we did quality improvement and the financial and operational performance improvement. This year, it's population health and EMS. And we'll give you some examples and talk through some of the things that you might think about this year. We, as with our colleagues at TASC, are always happy to help. And if we have questions that we can answer, please don't hesitate to reach out to us. So if we can have the next slide, Matt. Thank you. So I'll take a couple of examples. So as we look at population health, there are a couple of things that you might do. There is, you can start working on building capacity. Are your hospitals, and I know some of this may come from the population health readiness assessments that the TASC has put together. It may come from feedback from your hospitals, but you may find that they need some capacity. One of those areas is around the use of their electronic health records, particularly building patient registries to address chronic conditions. So we know the registries are associated with improved outcomes for chronic diseases. It allows patients to monitor and manage their panels. They track clinical diagnoses, target quality improvement, all of that. And then, so your outcomes are really going to be driven by what it is you're trying to do at the state level. So if it's an educational program, for example, that you're going to bring a group of CAHs together, talk to them about how to use their electronic health record, put that in the context of chronic care management, then your short-term outcome will be whether or not the percentage and number of staff who are participating that are reporting increased understanding of the patient rosters and how to use them as part of their process. If you provided technical assistance to individual hospitals or cohorts of hospitals, then you can push a little further on that outcome measurement and talk about the number and percent of CHs that are actually implementing a patient registry for one or more of the chronic conditions. And so these are short-term, a year to year and a half, maybe 2 years at the most. But again, look at are you picking an evidence-based intervention? And if you are, what is it you're doing to help the hospitals with that intervention and pick your outcomes that way? If you've done some longer term work then with your hospitals and TA, then one of the intermediate outcomes would be the number of patients that are being managed under those registries. It's a strong context and capacity. So another is chronic care management. We've all heard about chronic care management over the years. We know that it's reimbursable for under a number of third-party payers. And they really are an important way of working with your patients or your hospital's patients that have chronic conditions, and it's a whole care process that moves them forward. So again, depending on what you're doing and how you're getting there, and I would argue that in a perfect cycle, if you're beginning a competitive cycle, you might want to look at sequential steps over the course of the 5 years. In this case, you're looking at an NCC that may be that's a little further along, then pick those outcomes that may make sense. If you're looking at working with them to implement chronic care management, some of the short-term measures of the number, are they actually working with patients? What are the numbers and percentage of patients with chronic conditions that are registered and participating in the CCM program? Are they getting self-management education and support? Are they participating in CCM interventions? So if it's around hypertension, are they keeping a blood pressure log? Are they setting weight loss exercise goals? And they're short term. So if you you should be able to measure some of those within a year and a half. Intermediate goals are whether or not your patients are beginning to are showing an increase in the percent and number of patients that are receiving monthly check-ins. Are they actively participating in the CCM? Are they satisfied with their participation? Are they improving the scores, the satisfaction scores? Are you reducing the number and percent of patients who are non-compliant with treatment regimes? What we know is that regimens. So we know that chronic care management, it's bit of you've got to watch your weight, you've got to eat properly. There are a whole variety of things that people may not be compliant with. And then finally, and this is probably within 2 to 2.5, 3 years, are you seeing a reduction in the number and percent of patients with poor control of key biometrics? And these will be specific to the disease. And as you look at longer term outcomes, this is one way of measuring within the patients being treated in your chronic care management program. Are you seeing reductions in the number and the rate of readmissions after discharge for all-cause readmission? So again, a lot of this is a step-by-step process. Think of it as a roadmap or a set of instructions that if you do these things, then you'll move towards the longer term outcome. We can, and now we'll EMS. And I should tell you that among the program areas, EMS and population health are probably the more challenging of activities because you can go in a number of different directions. And we've found that as optional areas that it's been a bit more of a challenge. So if we're looking at EMS, again, we'll get to a capacity building. One of the things we know is that a lot of EMS agencies don't do a very good job with the billing. And if they can't bill and collect financial information, they can't, how are they going to be sustainable? So again, think about what your interventions are. If it's education, you can only go so far with an outcome for education, but if it's part of a bigger process. So short-term measures, how many actually are improving, have an appropriate billing and collection capacity? Are they able to bill third-party payers and patients for services? Are they looking at improvement in the number of runs for which they have all the information? If they're not capturing insurance information, they're not going to be able to bill for it. Reduction in the number in errors in financial and billing data collected. And and if you're doing that sort of direct work with an agency, they should be able to improve that pretty quickly. The other thing I want you to think about is that there's a tendency to think the long-term outcomes happen a whole lot faster than they should, and a tendency to think that the short-term outcomes take longer. These, short-term, again, a year to a year and a half. The intermediate outcomes, are they reducing the time in processing claims? Are they having fewer denied claims? Is it taking less time to collect their money? Do they have an increase in the number of clean claims that are paid on the first pass, and reduction in registration areas? And these are things that you should be able to measure fairly easily, because many of this will come directly from a billing system. And then finally, if you're doing these things, if you're getting them set up with a better billing capacity, and they're collecting their data more accurately, and they're processing their claims efficiently, and they're getting paid faster, then, towards the longer term, 4 to 5 years, you're going to see improved financial stability based on key financial indicators. So it's an improvement in the percent of expenses covered by patient transport or transport revenues. Are you reducing the reductions in the percentage of expenses covered by other revenue sources, such as local tax revenues or grants? The trick is, and this is one that I find interesting, we have better understanding of what's happening at financial for hospitals in terms of basic revenue measures and ratio measures. Part of that's done is just standard financial practice. Part of it is the work that the University of North Carolina, our colleagues and the FMT have done around financial and operational performance improvement. We don't have the same level of ratio management and understanding within the EMS community, or at least that I've been able to find for these revenue management. So we've picked a couple that would show that you're doing a better job. And so that is, over time, if you're doing the earlier steps, then you'll get to those long-term outcomes. And then finally, one other area that's widely covered under the or discussed, I should say, in the Flex program under program area for EMS is improving TCD times and patient survival. And it's, again, a lot of TCD is process oriented. Do you how quickly are EMS agencies and ambulances responding to certain problems? Do they have the capacity, say, for STEMI to even do a 12-lead ECG on the ambulance and report those results? So all of it is improving the different steps so that a patient moves more quickly from the time of contact from EMS to the appropriate level of hospital care or not, and then looking at those long-term outcomes. And so some of the short-term outcomes, and this is a perfect example, it came from work that we had done with STEMI, and this was a hospital system in Michigan, but they looked at the pieces that prevented their measure their system from not working well. They were midway between Grand Rapids and Traverse City. And they found that 2 of the 3 ambulance services they worked with didn't have the ability to do a 12-lead ECG. So they improved that. They increased the number of staff who were trained on recognition of STEMI at the EMS level. Short-term outcomes, you increase in the number of staff with training on trauma, field triage protocols, or some of the guidelines around stroke and or STEMI. So those are things that can be done in the short term. Thinking intermediate, are you seeing an increase in regional protocols to improve notification? Are you seeing increases in patients receiving I can never say this properly. PCI is basically the balloon angioplasty within 90 minutes from first contact to STEMI. That's the 90-minute door to balloon time. Or if it's a case of a patient with stroke, they are arriving at the hospital within 120 minutes of stroke onset, and are they then receiving the fibro? That's another one I always stumble over, but the clot busters to medications within 180 minutes. So these are things, again, measurable, and pick a couple of those depending on where you are in your cycle of working with EMS around TCDs. And then finally, your long-term outcomes. Ideally, they should be more integrated into a system of emergency care, or are they reducing patient mortality for the specific TCDs? So all of these things, I think it's important to step back, say, all right, where am I? What have we done so far? Next year, under this NCC, you being asked, am I correct? Is it 3 to 4 measures, Laura, including those they've already done?
3 to 4 total, yes.
So pick some of these, be realistic about where you are in terms of your work and the interaction you've had with either the hospitals or EMS, and then pick examples like this. There'll be more examples in the process, in the document that's up on the TASC website. And if there are any questions that I can answer or my staff can answer, please don't hesitate to reach out to us.
Thank you so much, John. And now we are up to Natalia for MB-QIP, and we've got just a couple minutes left. So everybody just stay patient. Natalia will talk fast.
Yes. Hi, everyone. So my update is going to be short, but there are a couple important things to note. As all of you know, we released the measures under consideration, and the period for comments closed on February 28th. So at the moment, we are looking at the comments, going through them, trying to figure out from the comments which of the measures will be integrated into MB-QIP and which will not. So just to remind you, their goal overall in doing this is to get us to build a robust, rural relevant measure core set for MB-QIP, so that you have more options to support your hospitals in quality improvement activities. You will not be required to be reporting on all of the measures that we decide to integrate into the program. You will be looking with us and working with us and Arquita to ensure that the measures that you select for reporting and to support your hospitals in reporting are the ones that make sense in your own state. So in partnership with our Arquita team, we're in the process of announcing what those decisions would be, and you can expect that to come around May time period. So for the measures that will be feasible for implementation, as we determine based on the comments and a number of other factors, we will be adding them to a menu of measures, and that will become part of our usual MB-QIP eligibility requirements, which I will talk about briefly next. So how that will be operationalized is going to, more information will come on that in the future. So I just want you to just keep you updated as we are in that process. We're working really hard to ensure that there is clarity around what are the requirements eventually, but for now, you're expected to work closely with your critical access hospitals to begin to determine which of those measures would be the most feasible for you in your states. So that is what you can be doing in the meantime. The next slide. Okay, so here are some additional updates, just so that you're aware that we are working on the eligibility requirements, which will also be announced. All of this play into the integration of the additional measures that we will have, in addition to the ones that are being retired by CMS. So there's a lot of movement in the quality space. We are, for the moment, just staying on a paused eligibility requirement period. So that should help you continue to support hospitals in reporting the MBQIP measures that have traditionally been part of the program. So as you continue to support your hospitals in this, we will be just doing the best we can to put all of the feedback together to ensure that once we release an announcement on the MBQIP eligibility requirements, this will be broadly announced. You will have time, but for the NCC period, you will remain on the same schedule to report on the same requirements that we have been reporting on so far, except we are still in the suspension period, so there is no penalties associated with non-reporting. It's the same thing that we did right immediately after the COVID-19 pandemic. So if you have any questions, just feel free to email me. Next slide. So this is just, I know that I announced late last fall that there will be a change in the requirements. So the requirements will look slightly different, but at the same time, we expect that that you'll have more questions that at a different time might make more sense to answer. But if you have any questions at all, this is just a very brief summary of what you can expect, which I already discussed. We will be still in the suspension period.
I have a question.
Okay.
Do we need new MOUs signed or the existing ones work?
The existing ones will work. We understand that there has to be an updated MOU process that we'll be working with our partners to figure out what is the best process on that. But this is, just to not alarm you that there isn't a whole lot of changes for this NCC period on MBQIP, because we're still trying to make the best decisions and put that information forward in a way that is clear. So that information will be announced in partnership with Arquita, but more information to come at another time. In the meantime, if you have questions on what I discussed today, feel free to email me. I'll be happy to clarify, but thank you for staying a couple more minutes.
Yeah, and we appreciate you. And there's the, you can email Natalia, Laura with direct questions. You can email TASC with any additional questions, task@ruralcenter.org. Again, check out the forum. Give us about a week, maybe less, hopefully less, before we get this recording. I know that you're going to receive an email, I think from Nicole shortly, with a lot of these resources, and then we'll follow up in a week with the recording and things of that nature. Again, these slides are available already on the event page, as well as the TASC Flex Funding Guidance page. Laura, do you have anything to add here at the end?
Nope, just thank you all so much for sticking around. I know we're a few minutes over, but reach out to us and TASC and FMT and everybody if you have any questions. Arquita too, we're all here to help.
And thank you, John, and thank you, Natalia. We appreciate you very much.